Hey, welcome back, guys. My name is Grace, but most of you know me as the Bronx Doula. And today's topic is lightning crotch. You heard me, lightning crotch. Have you ever heard of it? I doubt it. Unfortunately, most pregnant, gestating people do not hear about lightning crotch and don't know the symptoms of it. Right now, its medical name is pelvic girdle pain, or PGP for short. This is still a very taboo subject. Anything that has to do with the female reproductive area, with the uterus, the yoni, clitoris, the anus, even breasts, is still very taboo. The pelvic area includes your hip bones, tailbone, your sacrum, and even the symphysis pubis. And you might be wondering, what in the world is the symphysis pubis? All right, so here, let me show you. Here's a model of a female pelvic area. See this? Isn't she beautiful? If you notice, you have one side, two sides, and then if you turn it around, here you have spine and the sacrum, right? Where your tailbone and your sciatic nerves and all those wonderful things are located. The pelvis does not sit in our bodies straight up and down. In reality, it sits tilted forward. This is so that it can support our weight. It allows us for full range of motion, so it lets our hip sockets and our leg bones to move. But also in pregnancy, by having this pelvis tilted forward, you are giving yourself the most area so that you can deliver the baby through. Now, the symphysis pubis is this area here connecting the two sides of your pelvis. This is made out of the same material as your earlobes and your nose. It's called cartilage. Now, when the pain in this area, on the symphysis pubis, is really severe, it is then called symphysis pubis dysfunction. And it's exactly that. It is a dysfunction of your symphysis pubis. That area can stretch to the max. It can come apart from the rest of the pelvic bones, and it can be very, very painful and debilitating. As your pregnancy progresses and your ligaments and muscles begin to prepare for the imminent birth, the joints and cartilage in this pelvis, in your pelvis, can become unstable. They can become misaligned, and as a result, they can become very painful. Now, early on, the typical symptoms of dysfunction in that area are grinding sounds. You hear like popping sounds when you're walking, sitting, upon standing, and you feel these weird sensations in your body. You'll feel it most when you're engaging the hips and the pelvic muscles, right? So, how do we engage? Well, the action of actually standing up and taking that first step. When we lay down, when we go to the bathroom, whenever we go for a walk, or our daily yoga meditation practices, you are engaging not just your core and other muscles, but your pelvic muscles as well. You can, in very severe cases, you'll feel pain, not just discomfort. You can feel this sharp. This is why they call it lightning crotch, because it will take you by surprise. You can feel this sudden burst of pain and discomfort right in your crotch. A lot of Latinos, Puerto Ricans, that's what, that's my culture and heritage. We call it, oh my God, my toto's on fire. Literally, it is, okay? But you don't feel the pain just in that area. You can feel it in the actual hips. You can feel it in your sacrum, your tailbone. The sciatic nerve can become hinged and bothersome, irritated, and that can add to what you're already feeling, okay? Now, you'll feel pain when you're walking in more severe cases, laying down, sitting. It don't matter what you're doing. You're having sex. It does not matter. It will always be painful, and this is why it's called a dysfunction, okay? Pretty much any time and during any activity, you will feel pain and discomfort. Now, this is not all that we imagine pregnancy to be, right? Because most times all we hear is the fall in love, pregnancy is so beautiful and so wonderful, and you get the pregnancy glow. Uh, Reality check. Not all pregnancies are so wonderful. Okay. And you can have periods in your pregnancy where you're feeling fantastic, and then other periods where you're feeling really lousy. Okay. This can happen to anyone, and it can happen at any time. And the sad thing about it is that we're not talking about this. We're not letting, our midwives know. We're not letting our OBs know. And we're definitely not letting our girlfriends and our friends know and our family members know what's going on. Because, you will realize that when you do open up and you seek comfort and the support from someone else, you will find more likely than not that they too experience this dysfunction. I experienced this dysfunction, and no one ever talked to me about it. It was just, you chucked it up. It's part of being pregnant. Deal with it. It'll go away on its own. But sadly, not everyone experiences relief once that baby is born. Now, pubic symphasis dysfunction can become incapacitating. It can literally make you feel like you are unable to do anything. Simple tasks such as going for a walk. Maybe you need to wash the dishes. You have to put the laundry, or maybe you used to play sports, or you want to do things now. You can't do them now because it's so painful and so discomforting. Now, the root cause of PSD is the loosening of the muscles and your ligaments thanks to the hormone relaxin. This hormone does exactly what its name implies. It relaxes your joints, it relaxes your muscles, the tendons, and it makes things more flexible so that baby can be born easier. Ask any pregnant person who's getting towards 8, 9 months of gestation, and they'll tell you, I feel like I'm a puppet. I'm jelly. Everything moves and grooves on their own, right? Just as this name implies, the hormone is going to do its job, and we all have relaxin at some point or another in our pregnancy. Especially if this is a second, third, fourth, you can start experiencing the effects of relaxing much, much earlier in your gestation, okay? And it's really important that you discuss this with your care provider, okay? You're not alone, all right? Now, PSD is a real pain in the butt, literally. Unlike other types of back pain, PSD is not easily remedied, right? There isn't, that go-to help you fix the problem or help it go away, right? There is no movement. There is no exercise. There is no amount of yoga that can take this away. The way to get rid of symphysis pubis dysfunction is birth, having this baby, okay? And unfortunately for some of us, me included, even after giving birth, you can still continue feeling issues related to the dysfunction you experience in pregnancy, okay? It can, doing exercises and doing very repetitive movements can actually make the situation worse, right? So you ever heard of rest and ice? Rest and ice. Anytime anyone plays any sport, that's what you need to do. The same thing when you're having this dysfunction. You need to rest. You need to ice it. You can also do warm compresses for a little while and then cold compresses another, and see which one helps you feel more supported and taken care of, okay? Please never ever ignore what you're feeling, okay? Never ever, whether it's a physical ailment or it's an emotional problem that you're going through, please speak up. Share it with someone that you trust, especially your midwife and OB. All right, this pain can affect you long term. All right, it can affect your long term health, and like me, I've said it already, you can have lasting effects such as disc problems. So you'll suffer from herniated discs more often. All right, of the lumbar spine. And to top it off, you could end up with pain that can continue long after the baby's born. All right, because again, as we discussed earlier, there's misalignment. Things have moved out of place. They don't go back as quickly as we thought they would, and sometimes they don't go back at all. Okay, so the only way to find relief is through birth. But birth takes time. You have to let your baby grow and gestate and be ready for this world, right? And then you want to have a birth that supports you so that you're not feeling out of control and in a lot of pain, right? What can you do to find comfort? First, tell your midwife and your OB or other healthcare provider what you're experiencing. Be as detailed as possible. Let them know exactly where and use the names. My vagina hurts. My pubic bone hurts. My anus hurts. What can I do? Can you offer me some relief? Okay. Secondly, seek pelvic floor rehabilitation. All right. Here in New York City, we are blessed. We have an amazing resource, and it's called the Functional Pelvis. All right. They are a private physical and occupational therapy practice, and they're downtown Manhattan. Lindsay and her team is amazing. Okay. And she will let you know. Right now in pregnancy, unfortunately, there's not much we can do. We have to wait for your baby to be born, and then we can start doing rehabilitation, and we can start helping you feel somewhat normal again. It will take time. Please be patient and loving with your body. Be patient and loving with yourself. All right. In the meantime, while you wait for the referrals from your OB or whoever to send you to get PT, okay, practice mindfulness. So when you're lying down, instead of lying flat, turn to your side, right? Either side is fine. Okay. Use pillows to help support your back and also between your legs so that your legs don't feel like they're crushing your pelvis. Put a pillow right in between, and that allows for space between your legs, opens up the hip spaces, and you feel some sort of relief. Okay. Um, while sitting, make sure that you have good lumbar support, that the back rest of the chair or the sofa, whatever you're sitting in, or the floor has the support that your back needs. Okay. Also alternating, not sitting for too long, not standing for too long, not walking for too long, right? Not laying for too long. Keep your body. A body in motion will stay in motion. A body at rest will stay at rest. So it's really important, okay? When you're standing or when you're walking, keep an eye on your posture. This is something that I myself have to remind myself all the time because I am a chronic back pain sufferer because of pubic symphasis dysfunction, right? And no one told me that I had options and that I could have seen someone after the birth of my first two children to help remedy what I was feeling. Okay. You can wear what's called a vulvar girdle, and essentially it looks like a jock strap, but it's for the feminine body. It's for a female body, right? And you can ice it. You can put an ice pack in it. You can put a heating pad there to help bring down the swelling and the irritation that you're feeling. Okay. See a chiropractor. Have a myofascial release done. Okay. Cranial sacral too. That helps. Try some acupuncture, some acupressure, right? Those things are holistic modalities that you can use. There's no medicine, there's nothing, right? These are things that you can holistically and naturally do to help yourself feel better, okay? Dip in a pool. Water is wonderful when you're going through this problem, okay? Don't be afraid. Even if you have to spend half your day in a pool, go for it. What matters is how comfortable you are and the level of support that you're receiving. Okay? Seek medical advice from your midwife, obstetrician, or other healthcare professional that is taking care of you. Right? Have this conversation. Don't keep hiding these things from other pregnant people. The more we share, the better the outcomes we have in a birth community, especially for people of color and culture. Thank you so much for spending your time with me today. I hope that you've learned something, that I've been helpful, and I've provided you with some comfort and support. If you have any more questions or you need more help and assistance, please feel free to send me an email at info@bronxdoulaservices.com. Again, that's info, at bronxdoulaservices.com. You can also check me out in Instagram. Just type in the Bronx Doula. Boom, there you have it. May you have a blessed day and that you find comfort and support. Sat Nam.